Hello students, welcome to Legacy IAS Academy. In today's video, we are going to discuss about a new variant of COVID that has been discovered recently and also making the news headline, that is called as flirt variant. So how dangerous is this flirt variant? Should we worry about it? And how different it is from the earlier variant of the COVID? That is what we are going to discuss in details in this particular video. So first of all, to give you the background of this particular topic, a new coronavirus variant called as flirt or scientifically referred as KP2 has been linked to the rising cases of COVID-19 that we have seen in many countries including India, but mostly in countries such as US, UK and South Korea. Now it has been believed to be in circulation in India at least since November 2023 as per the data that has been released by the INSACOG, that is genomic surveillance data by Indian SARS-CoV-2 Genomic Consortium. About 250 such KP2 or flirt sequence have been reported so far by the INSACOG, the country's genome sequencing consortium, as we have discussed. Now, if you look at this variant in more detail, so as per the research, scientists believe that the new flirt variant or KP2 variant is basically a descendant of the older variant. This older variant was called as JN.1, and also few months back last year we have another variant of COVID that made a news headline, that is called as Omicron. So this particular variant is believed to be the sub-variant of Omicron lineage. However, few new mutations we have seen on this particular virus. Now referred as flirt basically because two terms here you can see is there. One is FL and other is R2. It is a basically nickname given to the KP2 variant, and the reason behind this nickname is because it represents two different mutations as we have discussed as compared to Omicron that we see on this virus. So these two immune escape mutations is called as FL and RT, and from there we have the word flirt. And it is this mutation that makes it different from the past variant of COVID-19, because this mutation allows the virus to evade the antibodies that the body might have created as a response to the vaccinations. Also, it is able to disrupt the major sites on the spike protein where antibodies bind and neutralize the SARS-CoV-2 viruses. These mutations allow the virus to escape thus antibodies, making it more dangerous, more deadly as compared to the past variant. So what is the genomic data says about this particular KP2 variant, especially we talk about in the context of India. So a little more than half of the 250 KP2 genome sequenced by INSACOG, that is Indian consortium, that is 128 sequence we can say roughly, were from Maharashtra alone. And India has been reporting the highest proportion of KP2 sequence if we talk about with the other countries where this variant has been discovered, such as US, UK and Asian countries such as South Korea. Global data has shown this as well. KP2 sequence thus today makes up 29% of the COVID-19 sequences that we have discovered, and it has been uploaded by India also to the GIST-8. Now GIST-8 is also called as Global Initiative on Sharing All Influenza Data, which is the largest database in the world currently where all such kind of influenza or flu based data are shared. JN1, that as we have discussed, of which KP2 is variant of, continues to be the dominant variant of SARS-CoV-2 in the country. That means in other way what we can say that currently in India two major strains of COVID is circulating. One is the JN1, which is the dominant one, and then second is the KP2, which we can say is the second dominant, and also it is something that is able to evade the antibodies. Now obviously the question that can come into our mind that whether this variant has the ability to cause severe diseases. So the answer is yes, because as we have discussed, the flirt variant is characterized by its ability to evade the immunity from vaccines, as well as even if people have been infected previously. We know that if infection happens the body creates antibodies, but these antibodies are not going to be very effective for this new variant, and that is why obviously the symptom can be more severe. The symptoms are not however different. It is similar to the symptoms that you see from the earlier variants of COVID as well, including fever, cough, fatigue, as well as some sort of digestive issues. Experts are watching the variant closely. However, at this particular point of time, they are not very concerned at the moment, because simply there is no indicator as such that suggests that KP2 can cause more severe illness than the other strains. Obviously, the rate of infection, obviously the extent of infection and the probability of infection has increased here, but the severity of infection is something that we cannot say has increased. And this is something that has been currently stated by the CDC also, that is US agency, Center for Disease Control and Prevention. So it also has clearly stated that this infection rate can go up, but severity is something that we should not be worried about right now. Now, infections can increase or not. So obviously a heightened transmission rate, because at its parent, that is JN.1, it is likely to drive a wave of infection. Now, one thing that you should keep in mind, that this infection is not going to be something that we have seen in other cases. Rather, this is going to be a silent spread of infections. Silent spread of infection means without causing severe symptom, most people are unlikely to get themselves tested also. Maybe people already are having flood strain of this COVID-19. However, they will not be able to understand that whether it is a normal cold, normal flu, or whether it is COVID related flu. And unless and until they get themselves tested, will not be able to know that which strain is causing it. So that is what we mean by silent spread. However, doctors and medical community has advised that stringent precautions, as we have seen in the earlier cases, should be taken, especially for the people who are compromised and who have compromised immune system. And vulnerable and most vulnerable population have also been delineated here, where vulnerable population means any people, any person who is having age 60 years and older, especially with pre-existing medical condition. They are more likely to experience severe and potentially fatal infections compared to other age group. Obviously, if we talk about the most vulnerable population, these are the people who are in the age group of 65 and old, also are immunocompromised, and are also pregnant women are included in this category. Also, the people who are having some sort of comorbidities like heart diseases, lung diseases, kidney infections and all, those are the one who need to take stringent precautions to make sure that they do not get infected. Again, in last we talk about the symptoms infections. So similar symptoms like before: fever, cough, fatigue, sore throat, runny nose, muscle aches. All these are also something that is seen in the flood virus also. Like Omicron predecessors mainly affect the upper respiratory tract of the body. Hospitalization rate of patients with these symptoms were not higher than usual. That is why scientists are not very much concerned, doctors are not very much concerned, even because of this new variant, and even though it is able to evade the antibodies. The preventive measures, same as we have been taken before. Social distancing is something that we have been taken before. Same thing need to be done again if the virus start to spread at a faster rate in the community. Now, one last discussion we can do is whether taking a booster dose or booster sort of COVID vaccine, whether it is Covishield or Covaxin, can help us fight against this virus. So, again, WHO, that is World Health Organization's COVID vaccine advisory group, it has advised the use of JN1.lineage as an antigen for the upcoming vaccine formulations, as the flood variants are within the JN1 family. However, if you talk about the case of India, currently none of the Indian vaccines are updated with this JN1 variant, of which flood is a subvariant of. And thus, booster dose, no matter whether you take or not in India, is unlikely to be effective, because it is the vaccine itself is not very much effective against the JN1 and KP2 variant. So, and most Indians, however, also doctors have advised that do not need a booster even if it was effective, because they have probably already had repeated infections several times, including silent infections even with JN1 variant. So, it is quite possible antibodies might be there for the JN1 variant. And again, also, even if you are able to take the booster dose, we have discussed that flood variant is able to evade the antibodies. So, again the question comes that whether this vaccine and booster dose will be effective or not, that is something that we have to discuss about. So, that is overall about the flood variant, the new subvariant of COVID-19, and related we have talked about how dangerous it is and how different it is from the other subvariants. That is all for this video. Thank you very much.